everybody, how you doing tonight? Cheryl Hentz here, and you're watching Eye on Oshkosh or listening to Eye on Oshkosh on the radio. This is a difficult subject that we're going to talk about tonight. We're going to be discussing suicide, suicide prevention. Not a fun topic to talk about at all. And here to help us navigate these troubling and sad waters, we have to my left Debbie Peters. She is the Executive Director of Community for Hope. And to my right, we have Patti Ahrens, who is a founding member of Community for Hope. And you're also the treasurer, so you keep all the money lined up and make sure that it's all there, right?
Yeah,
so thank you both for being here. Debbie, you've been on in the past.
Yes,
and,
I have. Thank you for having
this
us.
This is, I like doing these shows only because it's such a troubling topic, and it's one that needs more and more attention because we have more and more people who are committing suicide.
Right.
And so from that standpoint, I enjoy doing the show. I don't enjoy it because I've had very close people in my life, family members, commit suicide. It's a difficult conversation to have, but one that is necessary. So I want to put out some statistics here. Clearly, it's a major public health issue, and I think it's probably, the numbers are probably greater than what are published, only because there's a stigma that's associated with suicide. It's an embarrassing type thing. People don't like to be ridiculed, or people say mean things sometimes about people who commit suicide. So I think the numbers are probably a little bit higher than what we have here, but in the U.S., these are numbers that I pulled off, and you may have different numbers, but in the U.S., 1 out of every 15 people are depressed, and each day approximately 123 people die by suicide. Suicide's the 10th leading cause of death in the U.S. Each year, 44,965 Americans die by suicide, and for every suicide, there are 25 attempts. 1 million people die every year by suicide worldwide each year. And in Wisconsin, and this comes from, I've got the acronym here. What does it stand for?
It's the American Foundation for Suicide Prevention.
Okay, so they have, and these numbers can fluctuate a little bit, but the numbers that they currently have on their website, for Wisconsin alone, on average, 1 person dies by suicide every 9 hours here in the Badger State. And more than 3 times as many people die by suicide in Wisconsin annually than homicide. That is staggering, and also staggering is the cost. Suicide cost Wisconsin a total of $939,359,000 of combined lifetime medical and work loss in 2010. That number is staggering too.
It is.
But again, while you can put a price tag on the work loss and all that stuff, you cannot put a price tag on a person's life. And so we're going to try and save some lives here. So thank you again both for being here. Want to just jump right into things here. Let's talk first about Community for Hope. You're one of the founding persons who started this. So why did you start it? What was the impetus for getting this organization going?
Well, it started in May of 2001, and I lost my son in that month.
I'm sorry to hear that.
Thank you. And he was only 14 years old. And at that time, there had been 17 suicides in Oshkosh within a 24-month period, and 5 of those were within 13 months. And so Mickey Toll was actually instrumental in getting a meeting going with some key people in Oshkosh, and just stating that something needed to be done. So within that, more people joined the group, and within a short time, we had nearly 100 community members part of the group before we even had a name. So by the end of the summer, by fall of 2001, we had come up with the Community for Hope of Greater Oshkosh. So that's how we basically got started.
And how are you funded? I'm sure, like most 401k. You're not a 401k. You're a 501c3. I got too many numbers and letters in my head. How are you funded as a nonprofit organization?
Well, we had a huge grant from the Oshkosh Community Foundation back in 2001, 2002. And then basically grants, private donations, and Debbie can probably answer more where else we get the
We
get
do
money
work
from.
really hard for our funding. We do not receive any state or federal funding. So we are very blessed with people that advocate for suicide prevention, intervention, and grief support. One beautiful example on top of the Oshkosh Area Community Foundation, we have the J.J. Keller Foundation. And right now, they have given us a challenge grant of $10,000. So for every dollar we raise, up to $1,000 per donor, they will match that.
Wow.
And it's all or nothing. We have about 6 months to raise that $10,000. It's all or nothing by December 12th.
So if you get to $9,999, they will not match it.
Oh, I'll put in that extra dollar. No, they do such wonderful work, and we're very grateful for their support.
Sure. Yeah. Well, that's wonderful, and thank you to J.J. Keller Foundation, because that is tremendous. I want to just touch on NAMI a little bit. In the past, we've had people on from NAMI. NAMI stands for National Alliance on Mental Illness, and they are also a resource, obviously, for mental health issues, and depression is a mental health issue. So I want to just, we have their information. We're going to be putting that up throughout the course of the show. If you are listening to us on radio, I know you can't see us, so I want to give you at the outset here a couple of websites if you're listening to us on the radio. Community for Hope is communityforhope.org. We also have zerosuicide.sprc.org and NAMI Oshkosh, and NAMI is NAMI. So NAMIOshkosh.org, zerosuicide.sprc.org, and communityforhope.org. So let's talk, before we get too far into the nuts and bolts of this, you've got a walk that's coming up,
Yes.
and that's why you're on this time of year. The walk is coming up on September 22nd, is it?
Great memory. Yes.
And we have a flyer that shows that, so we want to put that up. That's got some details on it. And while people are looking at that, let's give details, because I know people on the radio can't see that. So Saturday, September 22nd, what time?
We are starting registration at 7:30 a.m.
Okay.
We have short programming from 9 to 9:30. We begin the walk at 9:30, and as soon as the walk is over, we have activities in Menominee Park. We're going to be in Menominee Park. We'll have yoga. We have some martial arts demonstrations. We'll have food wagons. And then of course, we have our memory wall. So we want to be able to honor those who have died by suicide.
Locally?
And locally, or anywhere anybody wants to bring a photo or create a memory board or anything like that. We want to honor their memory.
Sure.
And do it right.
Absolutely. So you said Menominee Park is where the activities are going to be going on after the walk. Is that where the walk actually starts from?
Yes.
Okay.
Yes. So we'll be gathering at Webster Stanley Middle School.
Okay.
For our programming and registration, and then the walk itself takes place on the trails of Menominee Park.
Well, it's a great place to do it.
It's gorgeous.
It's
Yes.
beautiful. So, and people don't have to, if they don't want to or they can't walk, they can just come and join you guys
Yes.
for the
Yes.
activities and so forth. So now I was told that, and we just gave the Zero Suicide Coalition's information, but I was told that you guys work with them in some way. How? Tell us
Yes,
about
I'm
that.
a member of the Zero Suicide Coalition. And what that is, I've got a little handout. We attended some training. There were several community partners that attended training, and the first thing that we were asked was, is 0 the number we should be reaching for? Well, of course it is.
Sure.
And if 0 isn't the number we're working toward, then you tell me what number we should be working at, and who in this room can we live without?
Mm-hmm.
So that really hit home for me.
Sure.
So what we do is we're looking at the perfect depression model, care model that came out of the Henry Ford Health System in Detroit. And through that model of perfect depression care, I believe they went 2 years with 0 suicides.
Wow.
2. So we took a 2-day training to learn that philosophy. So it's identifying those who need help, getting them the help that they need, and then making sure they don't fall through the cracks. And what they use is a Swiss cheese model.
Yeah.
So anybody who's dealt with mental health care, it's a bit daunting sometimes.
Sure.
And people, just like any other dentist appointments or medical appointments, you have a tendency to want to cancel or make excuses. And so there was this philosophy that's built around this care model that helps people get back on track, stay on track. If you missed an appointment and you listed me as one of your loved ones, I would get a phone call. And they would say, Cheryl missed her appointment. Can we check up on her?
So there's an accountability factor.
Yes, exactly.
Sort of an accountability manager type.
Yes,
thing.
yes. And
Okay.
I equate a lot of it to an intervention almost. So if you were doing an intervention with someone who's addicted to just about anything, you form this circle of people that love them and care for them. They are not judgmental. They are not bringing the skeletons out of the closet. They're there to make sure that you succeed.
Mm-hmm.
They are there to set you up for success. So it's working.
Sure.
It's working.
You mentioned that one of the first points is identifying those who need help, and that is sometimes, well, I don't want to say it's the biggest challenge, because I think the whole thing is challenging. People, again, this stigma of shame that can be associated with
Yes.
thinking about suicide or actually being successful at it. Even that sounds weird, saying successful
Yes.
at suicide, but I mean
That is a term that is common with some practitioners. I don't like it, but
so what
yes.
should I be saying?
Well, we prefer that when we're talking about it, that we refer to someone that died by suicide
Okay.
or someone took their own life. And historically, suicide was a crime. So committing suicide gives this annotation that, or connotation that somebody committed a crime. And historically, yes, your family was punished by that. But we're dispelling that. That's very long ago. So we're trying to use kinder, gentler language.
Sure. Well, there's also the whole religious aspect
Yes.
that comes into this. I'm certainly a very devout Christian, but those who are sort of Bible thumpers or very strict in their beliefs, very rigid beliefs, for them, suicide is, it's a sin.
Yes.
And you are going to be sent to hell. You're going to perish in hell for this. And I find that hard to believe. I don't necessarily believe that myself. The people who have committed suicide that I have been related to, they were wonderful people, and I don't believe that God is going to send them to hell just for that one thing. I personally believe that you're going to be judged on the entire portfolio, if you will, of your life, everything that you've done in your life, not just one or two little acts. But identifying someone who needs help is certainly, if not the biggest challenge, it's certainly a challenge, because if they're not coming forward saying, hey, geez, I'm feeling really depressed, or you don't notice that they're just down in the dumps, you know, how do you recognize, how do you identify someone who needs help if they're not giving off the signals that they do?
Right. I'm glad you asked that and brought that up. And with your personal experience, you've lived it. You know, you've lived
Yes.
it. One of the tools that we use is QPR. Question, Persuade, and Refer. It's called QPR Gatekeeper Training. We offer this for free. We go into work sites, we go into churches, we offer community training. Actually, we're offering it on Thursday, September 6th. We have 2 sessions. So we have workplaces that are already registered and just private folks that want to learn more. Q stands for question. How do you ask the question, are you thinking of suicide? P is persuade. How do you persuade that person to get some help? And R is refer. Where do you refer them for help? I'm not a counselor. Lots of people aren't counselors. So we know that through this evidence-based best practice program, it's saving lives. And before we get into the QPR, we teach people the warning signs, the indicators of depression, because we know that 90% of all people who die by suicide have a diagnosable mental health issue.
Wow.
90%. So when we teach people how to recognize those warning signs, and they're pretty prevalent in the state of Wisconsin, especially with our culture of drinking, and you know, some of the other things that we're unfortunately known for in this state, those indicators, they're so important. So we teach people what to look for. Are there subtle changes? And one of the best success stories I can share is a young woman had come to the QPR training. She was actually in high school. And I saw that there were multiple generations. I asked her, what brought you here? And she said, well, my cousin died by suicide, and my family's here. My aunts, my grandma, we all want to learn how to save somebody from suicide. Well, she called me a couple years later and said she used her QPR training. She was working full-time at McDonald's. And you know that group of men that gather at every McDonald's every morning, Monday through Friday from across the nation? Do you know what I'm talking about?
Yes.
Yes. So I finally found out what they're called. Romeos. Retired
Really?
old men who eat out. So that group of Romeos, there were 9 of them. And because she was working there full time at the age of 18, she knew all these men. And one gentleman in the group, he had lost his wife to cancer. And she was very concerned about him. So she approached those guys and said, could you please check on him? I'm very worried about him. I see the warning signs in him. So they kind of poo-pooed the whole situation, said he's just a grumpy old fart and he'll be back tomorrow. But he had missed 2 days in a row. So 2 of his buddies actually checked on him. He had purchased a handgun. He had written out a letter to his family. He had all of his financial affairs in order. He had even gone so far to take his personal belongings and put masking tape on it and label it who was supposed to get what.
Wow.
That 18-year-old girl.
He was close.
That 18-year-old girl working full-time at McDonald's saved that guy's life. She saved that man's life.
Amazing.
And that's what QPR can do.
So, you know, what are some of the signs? I mean, let's talk about that. I think it may be different in every situation, but there's some underlying signs that we see.
There is, and that is evidence-based. And so, you know, I think of examples of coworkers or a family member, and perhaps you don't see these family members on a regular basis. I think sometimes the hardest thing to see is someone you're living with. You see them all the time, and maybe they're trying to hide those signs from you, which is quite possible. But if you notice someone who typically was punctual at work, took very good care of themselves, they cared about their personal appearance, their hair, the way they dressed, maybe makeup, And then all of a sudden you see their personal hygiene isn't the same, or perhaps you're learning that their alcohol usage is increasing. Are they sleeping more often? Are they sleeping less? It's these subtle changes that kind of snowball into something more serious. So that puts up some very big indicators. Now with kids who, young people who die by suicide, they're very impulsive. And so we know that frontal lobe of the brain, we know that they can't process, they can't rationale, they can't work through trying to find a solution. So they are more impulsive than adults. So again, we look for these warning signs, and I get the question all the time, haven't you ever lived with a moody teenager in your house? Yes, I have.
Moody is one thing,
yes,
but
exactly.
these other things are something different.
And so we find that asking, are you okay? Are you thinking of hurting yourself? People find great relief because now their secret is open. Somebody is finally here to help me, and that has been proven. It's you're not going to put an idea in their head that's going to make them take their own life. That is not true. That myth has been dispelled. So we look for these changes, ask direct questions. Are you thinking of taking your life? And then let that person know, I care about you. I care that you live. I want you.
Sure.
I want you to be the person I know and love. I want you to be back to you again. And can we get you, I'll be with you every step of the way. Can I help you get the help that you need? And then tap into the resources, whether it's EAP, the Employee Assistance Programs, that where you work, or it's your family physician. That's a great place to start. If it's something more serious, then we call our county crisis team. They are phenomenal. Winnebago County Crisis does a really good job. Sure. And you can also call law enforcement and ask for a wellness check. I get phone calls quite frequently, and I call law enforcement. They call me back and say, I want to let you know I checked on this person and we have the situation under control.
And, and people should not be afraid to have law enforcement do wellness checks.
Yes.
I did one with my father. He just wasn't answering his phone, and he wasn't answering his phone, and he wasn't answering his phone. Well, he was up there in years, and I thought, and he lived like 20 or 30 minutes from us, and so I thought, okay, I got to make a phone call here. So I had the sheriff's department go out and do a wellness check, and it turned out he was fine, but, and I can't remember what the deal was, if he just wasn't hearing the phone or if it wasn't working, but the next thing I know, I'm getting a phone call, why the hell did you call the cops, Well, because I care about you, Dad. I mean, he was okay with it. That was just the first words out of his mouth.
And that's another great example, Cheryl, because people will say, I don't want that person mad at me. So again, to be very blunt and to the point, would you rather have a friend who's mad at you or dead?
Yeah.
Take that chance.
Yeah,
Take that chance.
exactly. And, and you have to. And as our parents age, and sometimes they're snowbirds too, so they're in two different places. Now, when he was down in Florida, he had people who were looking after him all the time.
Sure.
Constantly. They may as well have lived together. But up here, no, it was a little bit different.
Sure.
He was out in the rural area. One of the very close neighbors that he'd had moved away. And so I felt like, we needed to have him checked
Well,
on.
and that is another risk factor. So people of advanced age, I got to be careful because I'm getting in that advanced age myself.
Me too.
Social isolation is another risk factor, or having privileges taken from them, whether it be their driver's, their driver's license. Those are huge. And we've had cases here in Winnebago County with people that are 91, 93 years old who have died by suicide, and you look at some of those risk factors, And isolation is a big one. So whether they used to go to church all the time or they came to family functions and then all of a sudden they come up with these excuses not to join you and things that they used to enjoy, that is a huge red flag to say, hey, how are you doing?
Yeah.
How can I help you?
Well, in his case, he was still being so active, and that's another reason why I thought, why is he not answering his phone, Did he go away somewhere or whatever?
Sure.
But, there's no harm. If you're concerned about someone, there's no harm at all in calling the local law enforcement where they live and saying, hey, can you just do a wellness check?
Right.
I have also done that. I call the cops a lot, it seems, for for some of these things. But I had a wellness check done on a friend in Virginia. So it's just when someone starts doing things that are out of character,
Yes,
and
exactly.
suddenly you can't reach them or whatever when normally you could. It's best to just check on them and see.
And follow your gut instincts. We hear that a lot. And in the work that we do at Community for Hope, we also try to reach out to families who have lost someone to suicide. And unfortunately, those unanswered questions, or if I had done this, would it have changed the outcome? If I had, if I had done this or I hadn't done that, sometimes those are questions you'll never have answers to.
Right.
And nobody knows. Nobody knows. And
Sure.
it's so difficult to get through that difficult situation.
Yeah. I want to talk about teenagers committing suicide because we see so much of it these days. There's so much social media that these kids have access to and are exposed to. There's so much bullying. I don't care if you're too pretty, too not so pretty, too rich, too poor, too this, too that. There is bullying no matter what. Kids are just downright mean to each other, And as adults, it's sometimes difficult to take if someone's mean to us, but we can pretty much handle it. But these kids, they have so many pressures on them today. And I think that's one of the reasons we're seeing so many youth in our community alone who are committing suicide. And I just want to talk to you a little bit here because you did have a son who committed suicide, Patti, and he was 14, you said? And we don't have to get real deep into it because I know it probably still stings a lot. I know it does for me. But, we didn't have back then social media. We didn't have the bullying to the extent that we do today. Did you notice any signs? Did you have any inkling?
I really didn't at the time, but I didn't know as much as I do now.
Yeah.
Unfortunately, I had to learn the hard way. But he was very impulsive. So when Debbie had said that definitely was Nick's thing. He was very impulsive and kind of thought about the consequences of things later. And I really believe that was part of it, that he just didn't feel that it was going to be a final consequence. And other than that, he really had not shown any signs of depression or anything. So it was a total surprise. We were totally surprised.
Yeah. Well, again, so sorry for your loss. And, I think we've all, if we think about it, known someone or have known someone who has known someone who has committed suicide, especially when the numbers are getting so high that they are in this country, this world, in this state alone. And, before we end the show, I do want to talk about those of us who are left behind, because that's tough too. Told myself I wasn't going to do this. But grief support is very important, and so we want to talk about that. Let's talk a little bit about veterans because, they, right up there with the elderly people, veterans, they come back with PTSD from wars and other significant battles. And those numbers, let's see here, through my tears, I'm looking at this. Since 2007, there's been a rise in veterans who are committing suicide. And, I don't have numbers specifically. I tried to find that and I couldn't. But, I just don't think that veterans are getting the kind of care that they need, for sure. And then they're depressed. And I had a very good friend whose husband came back from the Gulf War, and he was affected by Agent Orange, and he ended up committing suicide. And then their son, I believe, committed suicide. I'm not sure. She hasn't been able to really talk about it. But it could have been an accident, I don't know, but his truck rammed right into a tree, and he was killed. So there would be someone who, he was depressed after his father passed away. And it's just, it's difficult. So what can we do for veterans? I mean, certainly they're able to call the numbers and access the resources that we've been putting up.
For veterans, we see that some of the younger people who have served are coming back with very alarming concerns of PTSD. So we've got a pretty wide age range that we're dealing with. And I know in Winnebago County, we do have a Department of Veteran Services. We actually have a new board member. He's in his early to mid-30s, who is a veteran himself and is helping to kind of tackle these problems. So number one, it's breaking that stigma to talk about it. And then it's also teaching their loved ones the warning signs. So again, using that QPR, if I had a brother or sister who had served and was displaying those warning signs, how could I intervene on their behalf? It's fighting for funding to get these people the health service, the mental health services that they deserve. That fight goes on constantly, and it's a matter of respect and taking care of those who took care of us.
Right, and before we started actually taping, you were sharing with me some of the numbers that are used from a law enforcement standpoint to fight certain things, contrasted with the numbers of dollars that are used for mental health.
Yes.
Can you share those for...
I don't have the numbers off the top of my head, but certainly when we look at homicides, there are more suicides in our state than there are homicides. And you think of the people
3 times
power.
as many.
Yep, the manpower that goes into investigating those, going to try to prevent those types of things, and then counterbalance that with what we're doing to prevent suicide.
Yeah.
It's just not there. We're not even able to compare apples to apples at all. So that, I think, is changing a little bit. It's coming slowly. I see the whole issue, especially with providing mental health services in our schools, community, teaching law enforcement how to direct people to those services, and physicians, your primary care physician. They have a responsibility in that too, and they want to be responsible for that. It's also trying to combat the shortage of psychiatrists. If I remember correctly, we are short about 400 psychiatrists in this state. 400.
Wow.
When some of them, I mean, might be a poor example, but you'll get the gist of it, but you're coming out of school and you have an opportunity to go to a warmer climate with a big paycheck to do the great stressful work you do. It's difficult to attract those type of professionals to our state. So we use telepsych, we use some creative resources, but that's also part of the equation.
So 400, we're down 400 psychiatrists. What about psychologists? Because they can play a role in this too. Is that down also?
Yes, it is. It is. So we're seeing some concerted efforts to rebuild that and to attract. but there's a lot of controversy that mental health care just isn't a big moneymaker.
Mm-hmm. Well,
and again,
it's not.
these healthcare systems are trying. They're trying to make money.
Well, it's not a big moneymaker, that's true, and yet when you look at those statistics of how suicide impacts the workplace, and on an average in our state, it is, trying to look at this here, it's on average of $1,184,564 per suicide death.
Mm-hmm.
And so these are real numbers that have been studied and gained through interviewing and what have you. So those are actual numbers. If we took that and put that into mental health, then we could start solving some of these problems.
You're right.
Now, why can't people see that? Who do we need to go to do something about this? I mean,
we have to go to those that are in the thick of things, that know their stuff, that know exactly what we need, and we have to go to our lawmakers and really help them see that creating mental wellness along with physical wellness, they go hand in hand.
Mm-hmm. Mm-hmm.
And you think of the money that goes into heart research and Alzheimer's, cancer, and all those other things. Yes, they all play an important role of how healthy we are as a state in Wisconsin. And we will be more productive if we're healthier. We will attract people to this state if it's truly what we value. And that's what it really boils down to. What do we value?
Yeah. Well, and the question always is, where do we get the money? Well, if we stop doing some of the other silly things that we're doing, like in Wisconsin, putting in all these roundabouts, we can save some money there. But roundabouts aren't all over the country. So, but we have to, we have to get our house in order.
Yes,
okay?
exactly.
And figure out what's a priority and what's not so much a priority. And I'm sorry, but I think saving lives should be our top priority.
Right. And I do see a slow trend in that. And you had mentioned before the bullying and these things that young children are facing. And how do we build resiliency? How do we create coping skills? And there are programs in place. One that I'm really super excited about, it's called Sources of Strength. And you can just Google it. It's a phenomenal program. It has been used with great success in the Hortonville School District.
Okay.
Neenah School District, I believe, is starting their 3rd year with the program, and Oshkosh is in their 2nd year. And so we know it's working because we conduct what's called the Youth Risk Behavioral Study.
Okay.
And in those numbers where we see kids who are feeling hopeless, depressed, thinking about suicide, we even ask kids in this study, have you created a plan for suicide to take your own life? We see that those numbers are changing. We're moving the needle, and Sources of Strength has been one really amazing program. And we've also received funding in the school districts to bring counselors into the schools.
So Debbie, the Sources of Strength, that is, if I'm understanding this correctly, it's a local type program?
It's a national program.
It's a national program.
It's a national program.
But we're doing it now locally?
Yes, we
okay.
are.
All right.
And it's building resiliency. It's building coping skills. It's it takes in a faith or your faith aspect. It takes the whole community and really builds these kids up to hopefully we can spill that over into adults too, because I'm 56 and I'm still being bullied from time to time, so we all need that boost every once in a while.
Yeah.
And to feel self-worth and to know that if I'm different from you, that's okay. How do we embrace that?
Okay. So, let's talk about if you feel like someone is perhaps contemplating suicide. I know that in years past, people have said things, and I've even said it to someone. You're not thinking about doing something stupid, are you? what should we say?
Not that. So this is
Sorry.
where I know, but it's, but that's.
But we do see it
Oh,
as
sure.
something
Sure.
stupid that they shouldn't be doing.
Right.
But, and so I've had awareness and an awakening over the years that I don't say that anymore.
Right.
Fortunately, I don't have to say anything like that to people too much anymore. But what should we say instead of that?
Yes, so that's part of that QPR training. We use that exact same scenario, and I'm guilty of it too. I have said that to somebody before. We should say, I'm seeing that you're not the same person that you were before. I noticed that you may be sleeping more often, and I'm concerned about you. Are you thinking about suicide? Or are you thinking of hurting yourself? We talk a lot about self-harm. Self-harm is a big issue with, young people and adults. And generally, that kind of breaks the walls down, and people feel relieved that I can finally talk to someone. And it's, again, making sure that that person knows that you care for them. You're not going to judge them. You're not going to belittle them, that type of thing. And then just let them know, I care about you.
Sure.
I want to see you well. Can we get some help together?
So when that conversation gets rolling then, the next thing that you, of course, want to do is point them in a direction to one of the resources that we've been putting up on the
Yes.
screen and that I've given to the radio listeners, these different organizations. Do you recommend that you actually help them reach out to those organizations together? Or do you just sort of put it in like the ball in their court?
Right.
Because they may not do that.
Exactly. So that's the tough part. That does get a little tricky. So if it were somebody, what if, for example, if it was a coworker of mine, I'd say, do you think that you might call your family physician? Or can I call your husband for you? Or may I talk to a close friend of yours or your mom or whomever it might be? And just keep working that in. And then make sure that there's some follow-up. So I'm glad that we talked. I want you to know I'm here to help you. I can't wait to see you till tomorrow, and let's talk about it again tomorrow. And then do that follow-up. In the QPR training, we do recommend following up with a phone call or a card. Some people are just more comfortable with text messaging, that, whatever works for that relationship that you have, but let them know that you will be checking up on them.
Mm-hmm. Well, I can see that in my case of these two family suicides, I guess I didn't handle them right. I mean, I didn't say wrong things to them, but I didn't say, let's call such and such, but also these were many years ago. We're talking 38 years ago in both cases, because they both happened within 2.5 weeks of each other. And so it was a very long time ago. We didn't have these kinds of resources.
Exactly.
I would even say that from the 17 years ago when Nick passed, that things have changed. And I would have been afraid to ask someone, are you thinking of suicide? Are you going to harm yourself? And now that is the thing to ask if you have that feeling.
I always say that people don't know what they need until they need it. And so when people are afraid, they'll say, I know I'm depressed or bipolar runs in my family or whatever the case may be. I don't want to go on medication. I know if I go to a psychologist or my family physician, they're going to put me on medication. I don't want to take medication. And I tell them, well, if you were diagnosed with diabetes or asthma, what would you do? Would you take your inhaler? Would you take your insulin? I hope you would, because I care about you. That's the exact same thing. You're taking care of yourself to live the best life you can possibly live. And again, I don't know a lot about diabetes or asthma, but if I had it, if I was diagnosed with it, I'd want to learn more. So people don't know. That's what's so difficult in grief support, is trying to help people work through their feelings, and so much of it is guilt. Had I known this, I would have done that, or that type of thing. Or you can't beat yourself up.
Yeah, and you can't second guess, which kind of goes along with beating yourself up. I mean, I don't think that I necessarily said the wrong things. Today I would have said the wrong things
Sure.
because we have resources now that I could refer them to. Back then, like I said, we didn't. But I did talk to them and so forth, and say we'll talk tomorrow, get some sleep, yada yada yada. The reality is also, I know you said we want to go for 0 people, but the reality is all suicides I don't think can be prevented, at least not in today's world. And, that's sadly something that we have to live with. I do like, we have been seeing some commercials on television about suicide and people who have actually felt suicide in their family. One he was a husband and a father, and I recall those commercials very clearly. But we've seen, how many suicides have we seen this year alone? And we're only at August 2nd. Whether it's people who are famous and they're in the news, and their suicides make national headlines, or it's just people locally who have done things to end their lives. And it's increasing, I think, at an alarming rate.
There's a contagion effect that is real, or that's often referred to as cluster suicides. So we think of Kate Spade or Anthony Bourdain, Robin Williams. Some people will fixate on that. Now, when you have multiple family members who have died by suicide, that is that contagion effect because they have that exposure. And on average, from one loss by suicide, we know it affects 114 people. So when you think of coworkers, neighbors, family members, and that age range is wide. That contagion effect is real. It's very serious. And so in our post-vention services, we're actually working on some new initiatives in Winnebago County that when someone dies by suicide, we reach out to their family within 72 hours because we know that that's a game changer. And through our collaboration in this community, we can put into place the counselors that they need, the counseling services that they need, and get it to them right away.
Okay.
Instead of the stigma increasing, it's almost like a callus. It just keeps getting harder and harder, and you don't discuss it. Getting to them sooner rather than later is going to save lives.
All right. Well, we're down to about 9 minutes or so. I can't believe sometimes how fast these hours fly by. But I don't want to end the program without talking about, the grief support that is there for people who have had someone pass away from suicide. So you offer something on your website,
Yes,
Community
we do.
for Hope, right?
We have 2 grief support groups, one in Neenah and one in Oshkosh.
Okay. Tell us a little bit about those. Are they large groups? Because sometimes people don't, they're ashamed already.
Sure.
They don't necessarily want to go. They especially probably don't want to get into a large group.
Right.
Tell us a little bit about what someone can expect if they go to something like
Right.
that.
So one of the things that's very alarming right now is the largest age range of those who are dying by suicide right now are middle-aged white males. So if you can think of the people who are losing their sons, they are a little bit older than I am. They're in their probably 60s or 70s. So we are seeing right now, our grief support groups do have some people that are in that age range, 60s, 70s. We have some younger people. Our Neenah group is pretty small, I would say, or very welcoming though. 4 to 6 members.
that is
and that
small.
Yep. And then the Oshkosh group fluctuates from anywhere from 8 to maybe 15
Okay.
in a group. And what I love seeing in these groups is that people feel a need to come immediately. And that year of first is really tough. Those first holidays, the first birthday, the first anniversary of your loss. And then people seem to gravitate or create friends. And so from those friendships, you might get a cup of coffee together. And then you learn to navigate life without that loved one, little by little.
Yep.
The hurt never goes away. You'll never forget them. You don't lose that. But you learn a new normal. And it does hurt, but you learn to manage that. And so you kind of wean yourself from the group. So our groups do change from time to time.
Okay.
We're seeing a really nice trend in people. For instance, if I had lost a loved one to suicide, I might get a card from Patty who says, I understand what you're going through because I went through it. And so through that communication and be able to speak about it, we might get a cup of coffee or a bottle of wine or whatever the case may be.
Sometimes wine is the best. It's the best medicine.
Whatever the
right?
case may be, but these friendships grow because you have this common bond, and that's the best outcome that we want from our grief support groups.
What if someone, I mean, typically I think probably the people who are going to these meetings are people who have had a recent loss.
Yes.
But I also know that, I mean, there have been times over the years that I've thought, geez, maybe I would benefit from something like this. I never went, no particular reason. Life happens, you
Sure.
get busy, and then you get into a place where you feel like, well, I don't really feel like I need to go right now. But I want to make it clear that anyone probably is welcome at these, no matter when their loss was. If it was 40 years ago or 4 hours ago,
Yes.
they're welcome at these meetings. So if they go to the communityforhope.org website, are the meeting times, dates, and places
Yes.
there? Okay.
Yes, the Nina group meets at First Presbyterian Church in Nina, and the address is there. And then our Oshkosh group meets the third Thursday of each month at our office at the Oakwood Center at Mercy Medical.
Oh, okay.
It's a nice room and comfortable and pretty easy to get to.
And what time of day are these meetings?
6:30 to 8 p.m.
In both cases?
Correct.
Okay.
The Nina group meets the second Thursday of each month.
Okay, all right. So, I know that we haven't talked a whole lot with you, but as a family member of someone who has committed suicide, are there any thoughts that you want to share with parents? Because really, this teenage suicide thing is getting out of control, Do you have words of wisdom for parents?
I would think, which in any case, trying to keep lines of communication open. Don't be afraid to ask if they are acting different than they normally do. Just some of the things that you do learn in the QPR training. And again, just communicating, don't be afraid to ask. Trying to spend time together. I know it's not always easy.
Well, sometimes teenagers or just kids in general, sometimes they just don't want that.
Right.
They
Right.
become very reclusive and they just want to. I know I can remember back when I was a teenager, I just wanted to hang out in my bedroom with my records and my TV and my phone. And I just wanted to close the door and just be by myself with my stuff,
Right. Right.
And that meant nothing. But today it may have a totally different meaning for someone.
And I think that's part of it too. I mean, everyone's busy, but even take that moment to kind of listen. Maybe you can pick up something that might give you a clue that they're not in the right place.
All right. It's not often that we hear about this, but we have heard about it on a few occasions and in other parts of the country where teenagers are making suicide pacts. Do you have any kind of anecdotal data that that speaks directly to that? Is that a common thing?
It is, unfortunately.
really?
Yes, it is. We had a situation in Winnebago County just last year. So it's alarming, and we use the advice that if you know something, say something.
Yeah, if you see something, say something. If
Yeah,
you know
exactly.
something, say something.
Say
if
it.
you suspect something or you hear something, I can't drive that home enough with people. You know, say something.
And don't ever feel, I mean, I get phone calls all the time and people say, I'm so sorry to bother you, da da da. No, don't ever feel that way. That's what we're here for. And don't ever minimize your gut instincts. If you're feeling something that's just not right, act on it. Let us know. But yes, unfortunately that is, and 13 Reasons Why hasn't been it's been helpful, but it's also been harmful to that whole situation.
Yeah. I'd like to, they had it up and then they took it down, and I wanted to draw attention to it. So if we can put that flyer back up one more time real quick, just in our remaining couple of minutes here, I just want to, again, make reference to the Run Walk or Walk Run that's coming up on Saturday, September 22nd. And I don't run.
I don't either.
But, and I would come for this event. However, I'm going to be out of state for that weekend. But I would encourage folks to go. Again, it's Saturday, September 22nd. The registration time is at 7:30 a.m. over at Webster Stanley Middle School, which is across from Menominee Park. And then that's at 7:30. At 7:30, there will be some other things kicking off. And then at 9:30, the walk starts, followed by a whole lot of different events and things going on, including a memory walk and so forth.
Yes.
So, and just in closing out, how can people get involved with Community for Hope if they want to help in some way?
We have just a lot of different volunteer roles, and it can be anything from becoming a QPR instructor to helping us send out thank you cards or putting stickers on flyers or manning our booths at back to school fairs or health and wellness fairs. There's a lot of opportunity to do that, and I'd love to meet with you.
All right. So contact communityforhope.org or give them a call at the phone number on their website, and they will put you to work.
Yes, we will.
So, thank you, ladies, very much
Thank
for
you.
being
Thank
here.
you,
I
Cheryl.
appreciate it a great deal, and I want to get personally involved in this QPR training, so I'm going to talk to you about that when
Great.
we finish up this show. But thanks again. Thanks to the crew. As always, thanks to you for watching. You are why we do this. And for those listening, too. You're why we do this. So we'll see you next time. Until then, take care. Keep your eye on us. We've got our eye on Oshkosh.